Welcome to this update today, January 20th. Kahsennenhawe sky dear yujat sa honda iente ne Ratitsénhaienhs. Dano degunuarado azawagwegu zigiga osaraze ni Kahnawa. So welcome everybody. It's been a while since I've been on one of these updates, and I'm going to apologize in advance if I have any difficulties. As reported last week, I did end up contracting COVID over the holidays, and nonetheless, my experience was very difficult. Once you're faced with having COVID and you see directly the impacts and how it impacts individuals, it's a really eye-opening experience. So, for me, there was I guess some feeling of shame and shock, to say the least. And it's 26 days later, and I still have some cough and some chest pain. So I'm going to apologize in advance if any of that starts to impact this update today. So I felt it was important to come on and show my face, so to speak. I know there's been some criticism maybe to the way that the council has been involved in this COVID-19 response, and I know there's a lot of people in the community who don't necessarily understand the way all of this rolls out. And we do have in the community what's called emergency preparedness law. It's there in the event of any kind of emergency that might happen in the community, things that we don't want to think of, natural disaster, train derailment. No one would have ever thought that we would be in the midst of a global pandemic now for 2 years. I could see the frustration that is permeating now in the community, myself included, my family members, my friends, people that I speak to regularly. Everybody's feeling some kind of way in going through this. But nonetheless, the way we responded, I felt was what we knew how to do at the time. And we appointed a committee, a response committee to deal with this pandemic, which became the COVID-19 task force. And for the last 2 years, in the times that we're in a state of emergency, they've been doing their best to put forth measures and directives, with the intent of trying to protect the community. And I know people tend to look at these measures and directives as, taking away their rights, dividing the community, and, things that doesn't come across in a way where, it's very positive. And I know it's been challenging right across the board, ourselves included, as Mohawk Council of Kahnawake, by not trying to politicize these issues and trying to look at it solely from an emergency response. We've had to, bring in experts, I guess, people from the outside, doctors, and all along we said, let's follow the science, follow the science. And I think it's important to highlight that although we've learned how to live in this COVID reality, the situation keeps changing, it keeps evolving, and maybe the things that we were doing a year ago is not what's working right now. Like, for instance, I hear a lot of people, well, why are you increasing the state of emergency? You think we don't know how to live with this now? And I have to share that the difference now was that the transmission and spread of Omicron this time around in December really could have crippled our emergency response in the community. And I think, as the people who have been put in these positions to make decisions on behalf of the community, there's so many factors and things that we need to take into consideration when making decisions. And none of it is taken lightly. I mean, nobody really enjoys and appreciates, some of the response, I guess, or backlash that we get from the community. But at the end of the day, we know why we are taking these decisions, and it's ultimately to protect everybody. But mostly, we talk about our elders, how important they are as our knowledge keepers, our first language speakers, the vulnerable people who have immunocompromised. I know people right now that are going through cancer and chemo treatments, and I worry about, their accessibility to outside hospitals. So we take into account everything in making these decisions. And like I said, I think after 2 years, no one enjoys, the way it's kind of pitted the community against each other, no matter what side you're on, if you're vaccinated or non-vaccinated, if you support the task force, if you don't, if you support the Mohawk Council or you don't. I think, the message I wanted to convey here today is our role and responsibility as Ganyagahaga people, as Kahnawake Hronu, that in a time when we are faced with great crisis is the time when we find a way to come together and to work together and to see each other as, extended family, and the interconnectedness that we all have to each other through our families. And it's important that, in this time right now, I know there's a lot of people criticizing, why did you extend the state of emergency? How come, we're not back to moving toward a way of just living, with the COVID reality, it being an endemic. And I think for me, looking at, through December, the sheer number of people in our community that were impacted by the quick spreading Omicron variant was very different than any of the other ones that we had faced in the last 2 years. The first 2 strains, a lot of people weren't vaccinated. People were dying, thankfully. And for me, this is another guiding principle. We look at everything that has happened in our community. Yeah, people have gotten sick. We've had some hospitalizations, but to say that there's only been one COVID-related death, to me, we have to take our hats off to everybody who has done their part, and whatever that part is. So looking at what had happened in December, at one point, and I know we weren't able to keep track in terms of the contact tracing, the testing became overburdened. Maybe there wasn't enough PCR tests to go around, but at estimates, there might have been 250 people who were positive and almost 1,000 people that were impacted some way, whether they had to be in isolation, they couldn't be with their families during Christmas and the holidays. And I know that was really, really hard for a lot of people, because for the last 6 months since June, we were in a state of recovery. We thought we were moving toward somewhat of a normalcy. Restaurants were open, movie theaters. We were getting back into a swing of, a way of living that we could all appreciate. And then boom, we go back into a state of emergency. So I have to highlight why. And it's not always, what's happening in Quebec, what's happening around us. We have to look at what's happening in Kahnawake first and foremost. And to have that many people contracting COVID at one time really put potential impact on our emergency services. To have a number of our Kahnawake peacekeepers, fire brigade, ambulatory services, people in the hospital, like whether it's nurses, even KSCS. So all of these people who we deem frontline workers and who are essential to keeping, our community going in the event of any kind of incident or, emergency, that was really scary and critical, and hence why we went into a state of emergency, because too many people were sick at once. It's one thing for it to happen over a prolonged period of time and, people to get sick in spurts. I mean, I think before the Omicron, we probably had at max during the Delta strain, maybe 40 people that had it at one time, and don't quote me specific on the numbers, but, it was nothing like this. So when the Commissioner of Public Safety came forward to the Council asking for this extension and highlighting, all of the things that are happening in the community, we know we've been in kind of like a shutdown mode for the last couple of weeks. There was the curfew, there's no restaurants, everything's closed, so to speak, and I think everybody has been limiting their gatherings, so we don't really know if there's going to be another dramatic spike in cases. So with all of the children returning to school this week, I think it was important for us to extend the state of emergency just to be on the safe side, because the last thing we want to do is move too quickly into a state of recovery and then have to revert back because we move too soon. And I think what it really does is give us a chance internally as the task force, the Mohawk Council of Kahnawake, to do an assessment, an evaluation of a plan moving forward, because we don't want to stay in this. I think, like we said, we've all kind of learned how to live in this reality now with the distancing, the masking, all the recommendations. So how could we, I guess, move ourselves into this way in the next little while. And the state of emergency extension in the law, it's a 30-day period. That's what it says. And the state of recovery is a 120-day period. So we're kind of bound by the law, but the fact of the matter is that let's say January 31st, we don't see the need for the state of emergency to continue to exist, we could stop it. So I just thought it was important to highlight that, because I know people were, you know, a little upset about, oh my God, we got to go through this for another 30 days and everything's going to be closed and so forth. But, you know, like I mentioned earlier, I think moving slow, assessing, evaluating, coming up with a plan that's a progressive return to opening. I think this weekend we're going to see the return of minor hockey practices, you know, so little by little, kids are back in school. We hope that it's going to, you know, help. I know there's a lot of people feeling it mental health wise. We're all frustrated. I could understand that and appreciate that after 2 years, you know, we're all just sick of it and want to move on with life. But, you know, I think as the leadership here in the community, we would be really remiss if we move too quickly. And like I said, all points considered, all things taken in perspective. And I really have to highlight the reality that the outside hospitals are in. I mean, I think we take for granted, like, we don't care what's happening on the outside. Our community is what's important to us. But there's a lot of people who depend on going to the hospital for different things. And from December 1st until now, the hospital is in a level 4 alert, which means that they could start diverting patients to other hospitals that are not close in our territory. So just to give you like an idea, like across the country, last week there was 5,000 hospitalizations across the country, and in 1 week it jumped to 10,000. So those are things that we need to, you know, take into account. And looking at everything, and you know, it does have impact on us, whether we believe it or not, because you know, people have babies, people have cancer, people need to go and get their dialysis. They depend on these outside hospitals. So if they're at a critical point and have you know, the potential to really be in a place where it could crumble, we also have to take that into account. So I know that might not be something people want to hear, and you know, the outside is the outside, and we have to look at Kahnawake first. You know, these are all the things that we had to take into account. I just want to shift gears a little bit. I know there's been a lot of criticism about, well, where does the money go, right? You keep extending the state of emergency. How much money is the community getting, and where's the money going? And I have to highlight that since the pandemic started, you know, we immediately created a response when we had to have the first shutdowns, and we had to develop the KERM fund, Kahnawake Economic Relief Measures Fund. We took from our emergency funds, we got money from the federal government, and we deployed, I want to say at the time, at the beginning, it was probably around 12 million. That has been expensed. Even up until before the last shutdown in December, just for KERM alone, which is individuals who maybe got KERM because their work location was shut down. We even provided for people who decided not to get vaccinated. And we know there was a couple of organizations in the community who held steadfast that if people were going to be working with vulnerable population or elders and they chose not to get vaccinated, you know, they weren't necessarily eligible for unemployment insurance. So we devised a policy in the KERM that gave community members a way to get money. It didn't happen right away. Like I said, we had to hear how many community members were impacted by this decision. So we ended up having a meeting with the EDC, which is the Executive Directors Committee, and we heard how many numbers. So out of, think about it, there's about 800 employees that make up the Education Center, MCK, the Fire Brigade, the hospital, all of the organizations across the community. And the numbers that we were given of the people who are going to be impacted by the vaccination measures in their workplace was a handful, like under 10. So those people came forward and we were able to give them KERM because they weren't eligible for EI. So we did our part to take care of community. Then there was the part of people who had to self-isolate because their children ended up getting COVID. We created a policy to cover them. We created the business interruption fund. You know, I think we've expensed about $15 million now trying to keep this community afloat. And again, I don't know what the future holds. I don't know if there's going to be future strains, or maybe we're just going to go in an endemic mode and we're just going to learn to live with it. But nonetheless, we have to be prepared for anything. So although right now we're in a state of emergency that has been declared up until February 20th, it doesn't mean that we have to stay in it until then. But nonetheless, as I mentioned earlier, the 30-day increment, we're bound by the way it's written in the law. And hopefully we can declare going back into a state of a recovery sooner than later, monitoring again the number of cases. And it's difficult right now, like as I mentioned earlier, with the sheer number of people who ended up getting COVID in December, we couldn't contact trace. We couldn't keep up with the testing, and then we ran out of tests in the community. So, you know, it's still at this point just trying to see all of the impacts and the short term with the students returning. And again, we don't want to move too quickly. We're trying to be as cautious as possible because that was really eye-opening, I think, to see that many people in that short a time frame get sick. And again, thankfully, everybody that I know recovered. And if there are, like I said, long-term effects, you know, there is long COVID. Hopefully, we could all deal with it. I think it's important, too, that I've heard this time and time again, use our traditional medicines. People in our community have been so good to each other, you know, when people had tested positive, you know, going and getting groceries, bringing them teas, bringing them medicine. That's the kind of thing that I like to hear in terms of when KahnawakeTV pull together and help each other. And I think, you know, in the spirit of what's going to happen in the future, and that we remember that, you know, we have certain principles and values as Ganyagahaga and KahnawakeTV, and taking care of each other, Gunurungwatsara. So, you know, let that be in your mind in terms of where we go. So again, I just want to acknowledge and thank the community for your patience, for your diligence, and everything that you have done to do your part to protect our community. I think in comparison to our sister communities, we're faring extremely well. Like I mentioned, of only having one COVID-related death, it's hats off to everybody who has done their part. And again, I know maybe the task force hasn't been held in high regard in a lot of your minds, but really think about it. They're your people mostly, and have done their part to protect this community. And we just have to remember that. Nobody had a playbook on how you're supposed to respond to something like this, but I think all of us have done an extremely awesome job, and I just wanted to commend all of you. And the fact that myself, Chief Ryan Montour, and other council members have made a commitment that we're going to be more involved in terms of these updates and being the face, you know, to the community about where things are at, where we're going. It's important to, you know, keep this openness and transparency. Not that I was hiding or anything. Like I said, in the last 6 months, we were in a state of recovery. But here we are nonetheless. We did have to go into a state of emergency, and I'm not saying we're not going to go into a state of emergency again in the future. You know, we're just going to keep going with this ebbs and flows of whatever this pandemic has to throw at us. But I just want to say Kahnawà to all of you for staying the course, as difficult as it has been. Like I said, in having to give up, you know, some of your freedoms or what we were used to doing, and it's hard. But so with that, I don't want to ramble, but just want to say that I appreciate all of you for all that you've done in trying to get through this, because that's the only way we're going to do it. We're going to get through it together. Tony Owanage, Nyawadzi Zawata Hunsa today.
Thank you, Grand Chief. So I just want to touch upon a few words that she had stated the number one word, I think the message that we got was freedom. Freedom for everybody is one of the biggest restrictions that is placed upon us right now. For the individual freedoms, individual rights. Under the state of emergency, some of them are, yes, they are impacted with certain measures and directives that infringe upon them. I'm looking out the window here at the task force. In the early 90s, a lot of men and women have fought for freedom. You know, we take it seriously. We don't take it lightly. With freedom comes great responsibility. I'm all for the individual responsibility, but we must take responsibility. I don't think I can stand here and just allow anybody to do exactly what they want. There's certain people that rely upon us for their security and their safety, and it's up to us as leadership in this role to protect that. I want to lay out a couple examples that did happen during the holiday period with our essential services. That is paramount to each and every one of us, no matter your political beliefs or your personal situations. At one time, the Kahnawake peacekeepers were affected by 16 officers down, including isolation. If you look at the numbers and the total strength of the peacekeepers, that was 30%. With their planning of Assistant Chief Peacekeeper and Head Chief Peacekeeper Dwayne Zachary, there was contingency plans in place. There was no threat to the security and safety of Kahnawake. All the administration had stepped up to ensure that the security was maintained. At the same period, the Kahnawake Fire Brigade was impacted very much. We had 4 positive cases of the paramedics. As we all know, the ambulance service is paramount to not only emergency service care, but for transferring of patients, either from our hospital or to get the ALS treatment or to transfer them from Montreal to come home. Present day, the peacekeepers have recovered 100%. I could stand here today and say there are 0 positive cases in the peacekeepers' ranks, 0 people in isolation. The paramedics, there are 2 positive cases at this time, 1 in isolation. The firefighters, during the holiday period, there was 5 firefighters. Average team to fight a fire, 4 men per truck, 2 trucks. You're talking half your force. Thankfully, we were prepared and talked about contingency plans to step up in case of emergency that didn't happen, but we were ready. The responsibility for this lands upon the people on this task force with the strategic planning, the operational planning, public safety, with the weekly task force meetings. It's the organization and the methods that we use that prepares us for situations like this. There was also one Kahnawake Fire Brigade officer during the holiday period that was COVID positive. So as you can see, these are hard numbers, these are hard facts, and that is why we initially started a state of emergency, returned to a state of emergency. So right now, there's new directives in place where all essential workers will even have to sacrifice more freedoms. They will have to be isolated 10 days. For the general population, it's 5 days, but the essential services are paramount to our lines of defense against this virus, and the common enemy here is the virus. It is not each other. We all have the same enemy in mind. I stated this before, there's nothing that can destroy us. We're strong, resilient people. We'll never stop to be. We have the community's best interests at heart. Operational organization of the task force is functioning well. I can give you some examples. We all seen the rapid testing that was distributed to the community. We do have another shipment coming in on January 17, was shipped. We're just awaiting it to be distributed for the community. Now, the commissioner does have special powers in a state of emergency where he can make that decision. He can make that procurement to get the rapid testing distributed to the community. We see other examples of renting the Knights of Columbus or the bingo hall to get the vaccination centers a bigger place. These are decisions that need to be made quick, and they need to be made without going through the red tape of government. So that's another reason why we can see that the task force operational level is working full force. The extra duties that the hospital people, the nurses and the PABs with the personal protective equipment, that was all bought through COVID task force money, and the measures that allow us to protect our loved ones. And I always like to go back to the 60 somewhat patients at the hospital. I think they are our most valuable resource. Everybody here has or knows somebody that is in the hospital. I'm aware of the natural caregivers that were given visitation rights this week. I think it amounts to 4 days, 2 blocks of 3 hours each. We are going to work on contingency plans to hopefully increase it. It will be brought up at the next task force meeting, but we are hearing your concerns. The surrounding areas, as Kahsennenhawe had mentioned, they are in a critical state. Anna-LaBerge is actually at a 4+ state, which means they could be closing some hospital beds. They could be diverting patients. They could be refusing treatment at one point if it does get to a critical level 5, where we will be sent out to different hospitals. Ormstown is in a better shape right now. The Glen, the Jewish, the Children's Hospital, they're all at alert level 4s, which means closing of beds, restriction of services, canceling surgeries. So the surrounding areas does impact us locally. Ambulance drivers, what used to be a 20-minute drive to Anna-LaBerge for a quick transfer, now they are walking into a COVID hot zone, as it's called, taking an hour and a half for a simple transfer. That's how critical the outside infrastructure is, and it's important for us to be prepared to have that second ambulance on call, to have the right amount of personnel, be able to make these life-saving decisions. We all know the first 3 minutes of response time in any emergency situation is critical to prevent loss of life. These are all measures that afforded us through the extension of a state of emergency. For me, myself, I know I stand here shoulder to shoulder with the emergency workers, with the nurses, with the PABs, with the people in charge, the heads of the fire brigade and the police and the task force and public health, and I stand behind my decision to extend it at this time, keeping in mind the Kahnawake Education Center has started school back this week. Yesterday at our meeting, we did have a quick update that I'd be willing to share with you today. There are numerous cases across the board in different schools, not exact numbers, but that was shared with me yesterday, day 2. So it's paramount that we stay vigilant, that we get prepared for anything that can happen. And as Kahsennenhawe said, if this thing ends in 2 weeks, it's over. There is a state of recovery plan that is outlined that has been approved by the task force. I will let the Commissioner of Public Safety outline that. I'm happy to hear that the kids are getting back onto the ice this weekend, so things are opening up. I hear all your voices. There are people you can reach out to the task force, myself included, Barton Goodleaf, the representatives from traditional bodies. Joe Diome is the point man on there, and Mike Benwell for Tuos Mohawk Trail Longhouse. There is recommendations to have another observer. That will be brought up too. We are listening to you. We're here with you, and we are making no mistake about the safety and security for Kahnawake. Yawagoa.
Thank you very much, Ryan. Thank you, Gus, for your words, and and your point of view, and obviously the ongoing support expressed by the Mohawk Council of Kahnawake, and some of the rationale, and explain to the community, again, why we are in a state of emergency. I think it's important that they understand fully, because under a state of emergency, one of the points I think Ryan mentioned is important to reiterate. Being able to make decisions quickly and effectively without having to go through the normal bureaucracy, so to speak, is important in a time of emergency, and as well as have the ability to reallocate various dollars, reallocate personnel and resources within the community, to ensure there's a proper response. So those authorities lie within the Kahnawake Emergency Preparedness Law. And as I said many times here, it also ensures that the rules and the laws and whatever measure is put into place is done under Kahnawake law and not outside laws. So what I want to talk about here is a couple of points this afternoon. There was a task force meeting held yesterday. It was lasted pretty much all afternoon. A lot of information and a lot of analysis being taking place, and where things are going. And we're trying to deal with what we have to deal with today. We're still very much in a response mode to the ongoing changes and evolutions that are happening with the pandemic. That's another rationale why we need to be in a state of emergency, because we're still very much in response. But we are looking forward to a recovery phase. We are looking for what I'm calling a path forward in terms of dealing with the pandemic, and looking at the whole issue of the well-being of our community. Obviously, physical health has always been the priority throughout the pandemic, but then we also took a more holistic approach. About the mental and spiritual well-being is equally important. And as things went on as well, certainly the social impacts on our community, the economic impacts, the political impacts. I mean, all these things have to be considered, when we're moving forward. So, despite some of the situation that we're currently living with, considering all these factors, we did try to chart a path forward, and also considering the fact that that the expectations and the predictions regarding the Omicron wave and the peak of hospitalizations and stuff, we are either very close or at that peak now, which is a good sign. It's showing that there isn't drastic increases as we've been seeing over the past few weeks. So hopefully, once we reach that peak, shortly thereafter, we'll start seeing a decline, and that will give us all some level of comfort. So with that said, we're looking at all the factors, and we're looking. We didn't set an exact date as we speak today, but certainly we're looking at the first week of February. For those businesses who are impacted, by current directives from the task force, restaurants, bars, social clubs, gaming, for example, to look at starting to reopen in the first week of February. There's still many unknowns. We have to take it day by day, because that's why we didn't set a hard date yet. But we want people to know that we are looking forward. There's a level of optimism that we still have, that we could take these steps moving forward and get the economy up and running once again, as quickly as possible, as soon as again the situation improves to a point that we feel comfortable in doing so. And indicators at this point in time are going in that direction. And also, we're looking at and hopeful, and part of the plan is, when we start the reopening, to do it in a much quicker way than we've seen in the past. We were very cautious. We were taking decisions every 2 to 3, 4 weeks, in the previous openings. Now we're trying to look at something and do something much more quicker to get people back to work, as quickly as possible, get the businesses fully operational as quickly as possible. At the same time, always monitoring and underscoring the fact that obviously health and safety is still the priority, but we also want to understand that economics is important. Not only for business owners, but the more equally important is obviously the people who work for these businesses also want to get back to work as quickly as possible. So also looking at that in the very near future, right now there are still some restrictions on gatherings, public gatherings, private gatherings, and such. So that will be reassessed very soon to move towards an area where people will have the more abilities to assess their own level of risk, and on how many people, for example, you want to have in your home, whether or not you want to go to a restaurant, or whether or not you want to go have a drink with your friends. Those are types of things that we've been promoting throughout the recovery phase. But also, even though a state of emergency, we're still trying to keep as much of that responsibility and with individuals. But as we progress, again, that's where the direction will be is individual. What level of risk are you prepared to take for yourself and for your family? And that won't be something that will be done by task force or such. So we're trying to respect that as individuals as much as we can. So what we want again to do is continue to assess the impacts of reopening of the schools, and Ryan touched on that a little bit because that is an area that is safety measures are in place. The education has done an excellent job. Public health was assisting them a great deal to ensure that things are done as best as possible. But there's still some unknowns there, and we want to see how that plays out, because if there are major concerns with schools, that has a major ripple effect across the community for parents who are working and such in businesses and essential services and so on. So we want to be very careful, before we take the next step. And everything going in the right direction. Like I said, we should hopefully see some significant changes very early in February. I am still optimistic, despite what's happening and currently happening, that in the weeks to come, things will look substantially different. Again, I can't make promises here. Nobody has the crystal ball, so to speak, but the indications are going in that direction, and we understand, again, like Gus and Ryan both said, we understand the frustrations that are out there within the community. I just want to touch on a couple more points. As you know, we do have the vaccination moved over to the Super Bingo, been there the past couple of weeks. It is operational as we speak today until 8 p.m. And it will be also there on Friday and Saturday from 9 till 4:30. So you can make your appointment through Kahnawake911.com and follow the links for Click Santé. That takes you directly to the Kahnawake link. And make an appointment or reserve your spot, or if it's not busy, they will take walk-ins if you suddenly have time to get your shot, and that's for all categories. Whether it's your first dose you want to get, the second dose, or if you're looking for 18 plus and looking for a booster, and also for the youth as well. So anybody who wants to have opportunity to be vaccinated, that is provided for them. And next week, we do have a schedule. We will be operating Monday to Friday next week. The exact schedule will be coming out, but then after Friday, that's where we're going to be looking at rolling back the mass vaccination in the community, because at that point in time, we feel there's more than enough time for Kahnawake and Ono who want to get a vaccination will have the opportunity to do it. It has been relatively quiet over at the vaccination center, a steady flow, but there is more capacity. So I want to relay that information to you, because vaccination again is still a cornerstone in ending this pandemic and keeping you and your family safe. I know people are questioning at times. People who are vaccinated are still getting Omicron, or still getting COVID, which is true. But on the flip side, it's also, people who are vaccinated are also having much less symptoms, and for most part, keeping people out of the hospital and keeping them from dying. So vaccination is still a very important element in that. So I guess that's important for people to understand, and that opportunity will be available until next week. Just on a final note, as Gus had mentioned, there are various funds that are available, to the community, and I won't repeat anything that Gus had mentioned, but just recently, this week, we did get notification that there is additional funds coming from the federal government. Kahnawake is eligible for its share, which is going to be roughly $1.3 million, which is used for COVID response. And it could help in many areas, such as food security for Kahnawake, vaccination costs, assistance with nursing, identified costs in terms of what we need as a community to properly address the pandemic. So there are dollars that are out there, but believe me, as fast as they come in, and the people in finance can tell you, as fast as some of these dollars come in, they get expended just as quickly, and using it for whatever is required, whether that be the Kahnawake economic relief measures, whether the business interruption fund, or whatever else is identified by the task force or by the council or other entities. So it's a very holistic approach. I'm glad to see that we have Gus here today and Ryan, to show that we are working hand in hand to ensure that we do get through this together. Again, I am still optimistic that we will get through this, and things in the next couple of weeks will look much, much different. So with that, thank you very much. Onigai, talk to you soon.